Jake Sadhu. Jake Sadhu. Jake Sadhu. Jake Sadhu.
Hello, good afternoon. Welcome to the press conference. Today we have Mr. Thomas Queenie from, he's a Director General of the IFPMA, and who'll just go cut straight to the press conference. Mr. Queenie, the floor is yours.
Yeah, I think it's on. Good afternoon. I'm really pleased to be here in Bali. I have to admit it's my first time in Bali. I've been to Indonesia before, but never on this beautiful island. But I've come here for work and not for pleasure, in contrast to most others. And the reason I've come here, I represent the global innovative pharmaceutical industry, vaccine manufacturers as well as pharmaceutical manufacturers. And I think it's fair to say that our companies have come up with most of the vaccines and treatments which have been used, for example, by COVAX. And more than 80% of the vaccines used last year by COVAX have been manufactured by member companies of IFPMA. But I've come here in particular because we are not discussing here, what was done in the past, but the focus of the Indonesian G20 presidency is really how to build better for the future, how to be better prepared for future pandemics. And that's why I really appreciated the invitation for us to be here, because our industry has shown during COVID-19 how fast one can respond based on a strong innovation system by doing in a pandemic business not as usual, but by reaching out to the public sector, by reaching out with everybody involved in terms of sharing the data, sharing the results of clinical trial studies, scaling up manufacturing, engaging in unprecedented number of voluntary licensing partnerships. But first, I really want to congratulate the government of Indonesia, and in particular, Minister Budi Sadikin, who has been a great leader and continues to be a great leader of the health work stream of G20. I've also been impressed when I looked at the data on the vaccination success in Indonesia. The number, I actually just mentioned to Minister Budi Sadikin, I wish as many Swiss would already have their booster shots as people in Indonesia. And the reason is not that there's a lack of vaccines in my country. The reason is that people are not falling over each other to get vaccinated. I have to admit, I got my fourth one, and not by rushing forward, but by just being rational and reasonable, because I got my third one in November last year. And when I look at the data, you're better protected if you have a fourth one, and I will get, an adapted one as soon as I can. But what we are discussing here from our industry is, on the one hand, we are interested in collaboration on research. We are interested in collaboration on better geographic diversity of manufacturing. That's, of course, a decision which is taken by individual companies. But we also interested in talking about what are the enabling factors one needs to have to make sure that this collaboration happens. And one of the elements which I brought to here, and I will talk about this afternoon in a session of the Health Work Stream is that we see multiple initiatives on expanding manufacturing, on geographic diversity. They're important, they're necessary, but at the same time we also see concern if it's not sustainable, if this is not met by demand, if we do not have the skilled workforces. For example, in some parts of the world, a strong regulatory system, we may struggle. But in addition, if you really want to respond faster than this time to a future pandemic, we believe that the industry collectively can contribute to pandemic preparedness by a commitment to put aside part of production upfront for vulnerable populations in developing countries. Something which we noticed was missing this time. We realized this late. Reasons were multifactorial, but I think the commitment from the industry to put aside part of production, whether it's vaccines or treatments, can give us much better tools for future pandemic preparedness. This really is my introductory statement, but happy to answer questions and engage with you.
Okay, now we start the questions and answer session. Is there anyone who would like to ask?
Right. Thank you so much. Please allow me to introduce myself. I'm Zul Hafiz from TVRI World. And I'd like to ask about the commitments of IFPMA, commitment on this health working group here in Indonesia. I mean, the readiness and preparedness in facing the future pandemic. Thank you.
Yeah, happy to answer. I think there are two commitments. One is, as we saw during the current pandemic, our companies engaged in an unprecedented number of public-private partnerships. The scaling up of manufacturing, we have seen more than a doubling of global vaccine output just for COVID vaccines. Would not have been possible without the partnerships, the collaboration, and not just among the IFPMA members, but also with developing country vaccine manufacturers, such as Serum Institute of India, biologically, Fiocruz, Aspen in South Africa. Therefore, there's clearly a continued commitment from our members to continue this kind of partnership. There's also a deep sense of the need to make sure this time we got the first vaccine administered in 326 days from the genomic sequence of SARS-CoV-2 discovered. We are very supportive of the 100-day mission, which was developed under the leadership of the government of the United Kingdom to make sure that next time we hopefully will have a vaccine or treatments in 100 days. You could not do that without really advanced preparedness, whether it's clinical trial, whether it's sharing research data, whether it's engaging together, whether it's support from the regulatory agencies. And that's one element. The second element from our side is also the analysis from our side was where the world could have done better is in equitable rollout of the vaccines. Now, the reasons why it didn't work that well were multifold. One of the reasons was export bans, border controls, and the two countries which there, shine out not in a favorable was the United States and was India. Both of them imposed export bans. When we look at that, we believe that it's important that we have, for vulnerable populations around the world, irrespective where they live, vaccines or treatments or diagnostics available upfront. That's why the new commitment, which all our companies signed up to put aside part of the production upfront for rollout to vulnerable populations in developing countries, such as frontline healthcare workers, is an important one. I mentioned that because we are also deeply conscious that this will have to go beyond companies making the commitment. It will only work if we can reach a social contract. Social contract means that, for example, the rich countries need to be willing to provide funding upfront so that WHO, COVAX, Gavi can, procure these vaccines, treatments, or diagnostics. And the second element is if countries allow that part of the local production of their vaccines, treatments, or diagnostics can leave their country to be used in other parts of the world where people really are in desperate need. That's what we saw this time. You had countries said, we are willing to share once everybody in our country is vaccinated or gets treatment. Therefore, we really need a better social contract. And I must say already, as part
Recording
of
in
the
progress.
discussions I've had here and in advance of coming here, I really feel heartened and encouraged by the positive response to this request. Minister Budi Sadikin, for example, when we talked about this, he was very positive, and we need to engage with the G20 governments and the G7 governments, because industry making that commitment needs to have the counterpart from governments from around the world, not just the rich countries, but also other countries, allowing this to happen. And we are looking for dialogue on how can we agree on the principles, how to make this work. What would be the operational nature to make sure that, for example, the 1% of the world population, frontline healthcare workers, are not left waiting too long before they get vaccinated or have treatments available, or the elderly have it wherever they live.
Thank you. Any more questions? Okay, I think maybe that's all. Do you have anything else to add, Mr.
I must say I'm really pleased to be here, your wonderful country, on this wonderful island of Bali. Of course, I'm jealous that I'm not one of the tourists who can stay here for a week. It would be nice. But I do believe that actually if we join forces, if we do have this dialogue between governments and the industry, the private sector, we can make progress. And one of, I think, the positive outcomes of the COVID pandemic is when I look at, I'm part of the ACT-A principles group in Geneva. I work with WHO. I sit on the COVAX coordination meeting where I work with WHO, with Gavi, with CEPI, with UNICEF. We really, I think, mutually increase respect. And we all, I think, understand that unless we collaborate, we will not make progress. And I think one of the elements which I learned from Minister Budi Sadikin is private sector is critical in terms of doing the research, development, and manufacturing of the countermeasures against the pandemic, and we need to have the dialogue between the public and private sector. But on the other hand, the private sector also needs to understand the needs of the governments and the citizens. And I think this mutual understanding makes me optimistic that we did better in this pandemic than we did in 2009 when we had the H1N1. We were much faster in scaling up and rolling out, but we could do better in making sure that we are even faster, 100-day mission, and we can do much better in terms of equitable rollout. One of the elements which the industry, I think, did in this pandemic, this is business not as usual. For example, all the companies did basically commit to discounted pricing, did commit to having the lowest prices for the low-income countries, middle prices for middle-income countries, and actually only charge the rich countries. Even, I hesitate to say market prices, because market prices would have been much higher than what was charged, But really, this was business not as usual. And that's what we need in a pandemic. At the same time, if we want to be prepared for the next pandemic, we also need to preserve the innovation system, which gave us the means to respond so fast. Thank you very much.
Thank you so much for your time. Is I could hopefully you can come back here, not working, with family. Yes, okay. This concludes our press conference for today. Good afternoon, and thank you so much.